Hello everyone, myself Dr. Aditya Gupta. In this video, I wanted to tell you what should be your exam day strategy. See, anyone who's preparing for either for NEET-UG or for NEET-PG, the amount of efforts that you have put in the past 1, 2, 3, whatever amount of years will always boil down to the 3 hours that you're giving the exam. So it's very, very important. It's imperative that you perform your best as far as your exam day is considered and that you do not falter as far as that exam day is considered. I just gave this talk on Cerebellum Academy on the Sunday on 16th of October, and I realized that other people can also probably benefit from it. So here it goes. So what should be the exam day strategy and how do you solve an MCQ on the exam day, and how do you attempt an MCQ even if you don't know the answer? So this is one of my seniors who always used to tell me that in an MCQ exam, there is no correct answer. There are 3 wrong answers and you have to figure out 3 wrong answers in order to get to the correct answers. And this is what is written in the instructions also. If you read the instructions carefully, they say, mark the best correct possible option. They're not saying choose the correct answer because it's fully possible. All the 4 options are correct. But your job as an aspirant and an exam taker is to mark the best correct answer. So whenever you're solving an MCQ, even right now for that matter, whichever app that you're using, whichever MCQ bank you are using, or whichever book you're using for solving MCQ, and this is valid as far as NEET-UG is also concerned. After marking the correct answer, that's fine if you know the correct answer. Always figure out why did the examiner take 10 seconds and try to take out why did the examiner put other 3 options. How was he trying to confuse you with the other 3 options? Why were those options there in the place? Why were the other options wrong? And that's why in the exam, if you don't know the answer to a question, you can actually rule out option and get to the answer. Another common mistake that a lot of people make is कि A option को देखते हैं that A option is correct, बाकी 3 options पढ़ते ही नहीं है and mark that. And this is the common decoy answer that examiner gives. Examiner ने 4 options सही दिए होते हैं. Will give all the 4 options as correct. One will be the best option. That probably option will be in B या C या D. But he will give you A also as the correct option, and in the energy like ये तो सही है मुझे आता है. You'll mark option A and you move on to the next question and you commit a silly mistake or a mistake which you should not have committed if you have read all the 4 options. So make sure you read all the 4 options. So I'll give you an example which of the following is true about Hodgkin's lymphoma. It's associated with night sweats, associated with HIV, modified anabar staging is used, hepatosplenomegaly is characteristic. Now, as far as Hodgkin's lymphoma is concerned, all these 4 statements are true. Hodgkin's lymphoma is associated with night sweats. Hodgkin's lymphoma, the lymphocyte depleted form, is associated with HIV. Modified anabar staging is used, and Hodgkin's can present with hepatosplenomegaly. But if the question is which of the following is true about Hodgkin's lymphoma, the best answer here would be modified anabar staging. Why? Because Hodgkin's lymphoma can be stage A or stage B depending upon. If there is A, there won't be any B symptom, they won't have night sweats and fever. Is it associated with HIV? Yes, but only one subtype, that is lymphocyte depleted, not all. Hepatosplenomegaly only occurs with this, in stage 3BS or 4 when there is liver involvement and spleen involvement. It's fully possible the patient has stage 1A, 1B or 1A, 2B where there is no hepatosplenomegaly that is present at that point of time. So the best answer here would be modified anabar staging is used. Why? Because modified anabar staging, irrespective of the Hodgkin's lymphoma, is used worldwide. Night sweats हो सकता है ना हो सकता है HIV से associated ना हो सकता है hepatosplenomegaly ना हो. But irrespective of whichever Hodgkin's lymphoma is there, oncologist uses modified anabar staging. The best answer here, all the 4 options are correct, but the best answer here is modified anabar staging. So there is not one correct answer here. All the answers were correct actually. There are 3 wrong answers, and you get into the habit of trying to figure out which is the correct answer by eliminating 3 wrong answers. There's certain easy tips and tricks that you can always remember to rule out option, especially as far as your NEET-PG exam is concerned. Remember, human body can have varied number of presentation. Human body is like every human body. My human body is not same as the person who's watching this human body is concerned, even though we both are Homo sapiens. So always is always wrong, never is never right. Especially as far as medicine is concerned, if the statement says this thing happens always, there's a possibility that it doesn't happen always because human body is so varied. Medicine में कुछ भी 100% नहीं होता है. So always is always wrong. किसी statement में if you feel there is always, that most likely is a negative statement, that most likely is a wrong statement, you can rule out that option. Similarly, never is never right. If a statement has this never happens, nahi, there is a possibility that it might happen. So again, a wrong statement that might be there. Another common trick that examiner pulls is using a double negative. Which of the following is not incorrect? Instead of asking which of the following is true, they're asking which of the following is not incorrect. Again, highlighting the importance why you should read the instructions carefully and you should read all the options and the question carefully. So 4 things that I have told you till now. Get into the habit of removing answer, eliminating options. Second thing, always is always wrong, never is never right, एंड डबल नेगेटिव के साथ तुम्हारे साथ प्ले कर रहे होते हैं. ऑलवेज रिमेंबर दिस व्हेनेवर यू आर अटेम्प्टिंग द एग्जाम बिकॉज दिस विल हेल्प you improve your silly mistakes. Next most important thing as far as exam is considered, you should keep calm. I remember my AIPMT prelims, I always keep on telling this that the very first question of my AIPMT prelims मेरे को नहीं आता था and आगे के भी 3-4 क्वेश्चन मेरे को नहीं आते थे. मैं एकदम ऐसे हो गया यार, आई प्रिपेयर 2 years फॉर दिस एग्जाम एंड मेरे को कोई क्वेश्चन नहीं आ रहा, बायो में कोई क्वेश्चन नहीं आ रहा. इट जॉटल्ड मी एंड देन आई वाज लाइक 5 मिनट हुए थे इनटू द एग्जाम, आई वाज लाइक आई कैन नॉट स्पॉइल इट, मेरे को सिर्फ 50% लाना है टू क्वालिफाई प्रीलिम्स. तो I took a deep breath, 5 minutes, for total 5 minutes, I took a deep breath, looked around, अच्छे से अपनी सांस आराम से ली. Deep breaths definitely help if at any point of time during the exam you're feeling that you're not able to your questions are getting wrong, you're not knowing the answer, just take a deep breath. अच्छे से deep breath लो. It really does help. And after that I attempted my bio section and उसके बाद के सारे 95 questions आते थे. All the 95 questions I was able to attempt correctly. I went back, checked again the 5 questions and I was able to attempt 4 questions also. बस उस समय की anxiety थी कि I was like, I was like in a panic mode कि exam नहीं आ रहा था. Another thing I will help, I actually made a video about this, go to the toilet. I know a lot of places probably won't allow toilet, but if toilet is allowed, then definitely go to the toilet. Last but definitely not the least, keep a water bottle with you. Don't drink too much, नहीं तो सुसु आने का मन करेगा and that actually might spoil your concentration. But थोड़ा बहुत पानी जरूर पी के जाना. And before going to the exam, make sure your bladder is empty. It should not happen 1.5 year into your exam कि तुम्हारा bladder empty नहीं है and that is causing you trouble. So before the exam, ensure you go to the toilet. During the exam, keep yourself hydrated, not too much. Right? Be in the habit of taking educated guesses. Especially as far as NEET-PG is concerned, let's assume this question comes to you, which of the following is not a cause of HUS. Now हमें पता है equal है 10157 तो होता ही है, dysentery, shigella dysentery भी होता ही है, and you might get confused between कि streptococcus है या staph है. Now an educated guess, if I would have to take this educated guess, I would have been like, yeah, streptococcus की classification is based on hemolysis, alpha, beta and gamma hemolysis. So I probably would have marks, तो इसका मतलब streptococcus can also cause hemolysis, right? So answer here would be staph aureus, which is the correct answer. If you encounter this kind of question in exam, in where you are able to rule out 2 options, you have to mark that answer. You have to mark that answer because it will increase the probability of you getting more answers correct. Which of the following is false about digoxin toxicity? I've talked about this before. Again, digoxin toxicity हो सकता है तुम्हें ना पता हो, but you know ना कि digoxin जो है वो AV bundle branch के में से conduction को कम करता है. So this answer, proximal atrial tachycardia with fast ventricular rate, this is a good guess because fast ventricular rate कैसे कराएगा यार digoxin, right? So this is the correct answer. अगर तुम्हें एग्जाम में कोई 2 ऑप्शंस दिख रहे हैं एकदम अपोजिट है, हेपाटिक फेलियर, रीनल फेलियर, मेटाबॉलिज्म का, फार्माकोडायनेमिक्स में, या कोई एकदम ऑप्शन एकदम कराता है या नहीं कराता है, मैक्सिमम नंबर ऑफ टाइम्स उसमें आंसर होता है to take an educated guess in that. For example, digoxin action is not affected by hepatic failure, kidney failure, potassium abnormalities, MI. So it doesn't really matter whether you know कि digoxin का मेटाबॉलिज्म किडनी है या लिवर है. You know कि पोटाशियम कराता है ना डाइजॉक्सिन का एक्शन अफेक्ट, राइट? तो किडनी फेलियर में पोटाशियम बढ़ेगा, सो दैट आल्सो विल अफेक्ट डाइजॉक्सिन एक्शन. तो किडनी फेलियर, हेपाटिक फेलियर, द एग्जामिनर वांटेड यू टू नो वेदर इट इज किडनी मेटाबॉलिज्म और हेपाटिक मेटाबॉलिज्म. आंसर हियर विल बी हेपाटिक फेलियर बिकॉज हेपाटिक फेलियर वोंट अफेक्ट डाइजॉक्सिन एक्शन. किडनी फेलियर विल विद द हेल्प ऑफ पोटाशियम. MI एक ऐसे उन लोगों ने ऑप्शन दे दिया. तो जो 2 ऑप्शन एकदम अपोजिट लग रहे होते हैं ना, हेपाटिक फेलियर, किडनी फेलियर, मेटाबॉलिज्म के टाइप में नॉट आ जाए एक स्टेटमेंट में, दूसरी एक्जैक्टली सेम स्टेटमेंट में उसमें नॉट ना हो, मोस्ट ऑफ द टाइम द आंसर इज देयर. टेक एन एजुकेटेड गेस इन दैट. Last but definitely not the least, number of questions to attempt. You have to attempt more than 180-185 questions. See, हम लोग on the exam day, not many people will know more than 50 to 60% of the questions एकदम correct. बाकी सब में educated guess होगा. अगर तुमने 2 ऑप्शन एलिमिनेट कर दिए या एक ऑप्शन में एलिमिनेट कर दिया बिकॉज ऑफ योर एलिमिनेटिव थिंकिंग, वो क्वेश्चन अटेम्प्ट करना है. 2 ऑप्शन एलिमिनेट किए तो इफ यू आर लीविंग दैट क्वेश्चन, यू आर डूइंग अ ब्लंडरस मिस्टेक. इफ यू आर एलिमिनेटेड 2 ऑप्शन, you have to attempt. I attempted 190, Zainab attempted 199, Rishabh attempted 195. Ask any topper, ask anyone. यार वो इतने just by the power of probability कि -1/3 है और सही होने पे 1 है और तुमने 2 ऑप्शन एलिमिनेट कर दी तो 50% पर आ गए, -33% है. ऐसे अगर तुम 10, 20 या 30 क्वेश्चन अटेम्प्ट करोगे तो स्कोर विल ऑलवेज गो इनटू पॉजिटिव, राइट? So make sure you attempt maximum number of question. As far as AIMS is concerned, try to attempt more than 180. Don't be like कि मेरी 100% efficiency होगी, क्योंकि तुम्हें लगता है जो क्वेश्चन तुम्हें आता है वो भी हो सकता है गलत हो, और जो तुम्हें नहीं आता और उसमें जो तुम एजुकेटेड गेस करने वाले हो वो सही होगा. तो in AIMS attempt more than 180 bare minimum, and in NEET attempt all the question at 1/4 negative marking. It's a blunder if you don't attempt a question. If you have eliminated even a single option in NEET, you have to attempt all the question. In AIMS, if you have eliminated 2 options, you have to attempt that question. So these are the tips and tricks as far as exam day strategy is concerned. Be calm, be confident. Don't let the noise affect you. And उस समय cool mind से अगर exam देने जाओगे, you will perform best. जितना तुम्हें आता है तुम उससे ज़्यादा अच्छा perform कर पाओगे. So this is my video for you today. Thank you and have a nice day.